Welcome to the Myeloma University module titled Treatments for Multiple Myeloma Part 2. My name is Beth Faiman and I am a nurse practitioner at the Taussig Cancer Institute in Cleveland, Ohio. In this short discussion, we will review newer drugs used to treat patients with multiple myeloma in the relapse setting. These include Selinexor, belantamab mafodotin, and venetoclax. Now let's begin with Selinexor. Selinexor is a first-in-class oral selective inhibitor of nuclear export or SINE. Exportin-1 or XPO1 is the major nuclear export protein for tumor suppressor genes and other proteins. XPO1 is overexpressed in multiple myeloma. High levels of XPO1 enable cancer cells to escape tumor suppressor protein-mediated cell cycle arrest and apoptosis or programmed cell death. Selinexor inhibits XPO1 by blocking tumor suppressor proteins from being exported from the nucleus of the cell so the tumor suppressor proteins can stay in the nucleus of the cell to do what they're supposed to do, cause cell death of cancer cells. Selinexor was first approved in combination with dexamethasone based on the results of the STORM study. In the study, patients had received at least 4 prior therapies yet still responded to Selinexor and dexamethasone. In December 2020, Selinexor was approved by the FDA in combination with bortezomib and dexamethasone in patients who had received at least 1 prior therapy and is currently available in 20, 40, and 80 milligram strengths. For patients who take Selinexor, gastrointestinal, constitutional, hematologic, and biochemical side effects can occur. To prevent the nausea, vomiting, and weight loss associated with Selinexor, prophylaxis of nausea and vomiting with a 5-HT3 receptor antagonist is recommended for all patients. Additional agents such as olanzapine can be added at bedtime for patients who are at high risk for nausea and vomiting. For all of my patients starting on Selinexor, I recommend small, frequent meals or snacks rich in sodium as hyponatremia can occur. A basic chemistry panel provides the patient's blood sodium levels. Fortunately, we see lower doses of nausea and GI side effects when Selinexor is given at a once-weekly dosing schedule in combination with drugs such as bortezomib, rather than at a higher dose as approved with dexamethasone earlier on. Hematologic side effects most commonly are thrombocytopenia and can occur. Therefore, a CBC should be obtained on a regular basis according to each individual patient. Dose reduction of Selinexor may be required for any of these side effects. Because of its synergistic activity with other drugs, a lower dose of Selinexor in combination with other agents is better than no dose of Selinexor. The third and final drug we will discuss in this module is venetoclax. Venetoclax is a highly selective, potent oral B-cell leukemia lymphoma 2 or BCL2 inhibitor that induces apoptosis in myeloma cells. The BCL2 family of proteins is known as an important gatekeeper of apoptosis. It contributes to the formation of a tumor-blocking programmed cell death, promoting cell survival. Venetoclax has shown activity synergistically with bortezomib and dexamethasone. In the Bellini trial, 291 patients with multiple myeloma received 1 to 3 prior therapies, were treated with bortezomib and dexamethasone plus or minus venetoclax. Due to safety concerns, the FDA ordered the partial clinical hold on all venetoclax-related trials in March of 2019, when results from the Bellini study showed a disproportionate number of deaths had occurred among participants treated with venetoclax compared to the number of deaths that occurred in patients receiving placebo. Upon review of the patients who did well, however, it was noted that when a patient had a translocation 11;14 chromosome or high bone marrow BCL2 expression, there was no increase of side effects or increased risk of death. In fact, patients in the study who harbored the translocation 11;14 chromosome responded better than those who did not. Venetoclax, bortezomib, and dexamethasone are therefore included in the treatment guidelines for patients with previously treated multiple myeloma and translocation 11;14. Side effects of venetoclax that are common with other blood cancers, such as tumor lysis syndrome, are not seen in multiple myeloma. In contrast to venetoclax in acute or chronic leukemia, there is no ramp-up period with venetoclax when used in patients with multiple myeloma. Patients should be observed for increased fatigue and cytopenias, but nurses should know that venetoclax is generally well tolerated in myeloma. Thank you so much for joining with me today to share in this discussion of 3 new medications with unique mechanisms of action to treat patients with multiple myeloma. For more information, please see these additional resources and watch for additional segments in this series. Thank you.